A little over a year ago, I witnessed my uncle experience a manic episode, and I didn't know how to help. He was driving the car with my sisters in the back while I spoke about the different errands we were running that day and how excited I was to get a haircut. He replied by a nod of the head and a few responsive grunts. I shrugged his attitude off as morning moodiness and didn't think much of it. But later on, as we continued with our errands, I realized he hadn't spoken a word in a long time. And whenever I spoke to him, he seemed to be in a daze, looking off into the distance. After a while, after my haircut was done, he seemed to be more engaged in the conversation, as we were all discussing what we would eat, debating between IHOP or McDonald's. I saw a glimpse of excitement in his eyes. But then, all of a sudden, his face grew serious and he stopped talking. I was shocked because just a second ago he had been engaged, but then it was as if he wasn't even there. In a hurry, I called my mom in a panic, asking her what was happening with him and hoping she could help me or guide me in what to do. She started to speak to him, telling him to drive my sisters and I home. He began to speak in nonsensical sentences, talking about driving to the Rock. It was at this moment that I felt a pit in my stomach because I honestly thought my sisters and I wouldn't make it home. Not because I thought my uncle was going to intentionally try to cause us harm, but because I was scared he wouldn't be mentally capable to drive. I didn't understand how to talk to him or what to do. I felt helpless. After we arrived home, I felt relieved. I went to my room to put away my things and made sure my sisters were okay. But then I heard a crash. I ran to the kitchen to see what had happened, and as I was entering, my uncle was slowly walking out. There was a container of screws, quite large, sprawled all over the floor. My uncle hadn't flinched or even acknowledged the fact that he had dropped anything. It was at this moment that the extent of his poor mental state truly hit me. Before this day, I had never seen anyone in my life act in such a disoriented way. It was as if my uncle wasn't even there, because in that moment, the episode was not only affecting his mood, but also his thoughts. Now looking back, I can see that leading up to this day, there were many telling signs of this episode, had I understood the symptoms of bipolar disorder, and I would have been better equipped to handle such a situation. Mental illness as a whole affects many people. Because the majority of them are not well informed, they're left to suffer, undiagnosed and unable to cope with their illnesses. As reported by the International Journal of Mental Health, there are approximately 121 million people living with depression. Mental health accounts for 12% of the global burden of disease. Depression is expected to become the second most important cause of disability in the world. These statistics were recorded in 2009. Imagine how far we've come. Certainly, there have been improvements in at least some of these mental illnesses with the evolution of medicine and healthcare, right? Well, no. As reported by the World Health Organization in 2020, more than 264 million people suffer from depression worldwide. Depression is now the leading cause of disability in the world. So what are we doing wrong? How can we as a society help sculpt the future and improve how we regard mental illness? Let me ask you this. What if we all knew how to combat depression? How many deaths could we prevent by simply understanding what this mental illness entails? how different would our everyday lives be if we not only accepted mental illness as a whole, but also learned how to deal with the variety that exists. Mental illness is a very pressing topic in not only the adults of today, but also the youth. With this pandemic, cases of mental illness have increased, but prior to the coronavirus outbreak, many people were already suffering from daily anxieties and depression. With the rise in these illnesses due to the pandemic, poverty and the lack of resources have been significant contributors. Well over half of the US's population are fortunate enough to have access to technology, but in other parts of the world, specifically in third world countries, many people don't have the luxury of researching their possible symptoms with the tap of a screen. Without this accessibility to important information, so many lives are made much more difficult. As of 2019, there has been a report by Statista of 44.4% of individuals living in developing countries with internet access. This means that more than half are still living without access to the internet, compared to the 86.7% in developed countries. We see that there's still a large gap for improvement from a technological standpoint. Research curated by the World Health Organization showed the correlation between poverty and mental illness, stating that common mental disorders are twice as frequent among the poor as among the rich. People living in poverty are more prone to develop a mental illness, and with their lack of technology, due to their lower economic status, can't access the internet for information. A cycle of poverty breaching mental illness and mental illness, people with mental illnesses entering into poverty forms. It is up to us to stop this cycle from continuing. But we must remain hopeful, for there are still ways in which we can implement change around the world, such as by donating to foundations that are using effective techniques to improve people's knowledge and directly treating their mental illnesses. Strong Minds is an organization that focuses on proficiently handling the depression of African women. It has continued to persevere by hosting group therapy sessions, but now needs more help than ever, with the pandemic increasing cases of depression everywhere. America is also facing the issue of people entering poverty and, to be blunt, homelessness after being left with a mental illness. As reported by the Treatment Advocacy Center, approximately 33% of the individuals that are homeless are individuals with untreated mental illnesses. How can we fix this percentage and change the way we talk about mental illness so people aren't living on the streets because of it? In order to change the outcome, we must have a plan for prevention. We must help the youth of today understand the severity of this issue and bring them into the conversation about depression and anxiety. Releasing the shackles that stigmas and stereotypes have placed on these illnesses has been the goal for quite some time. But we're still in dire need of education, for the numbers are only increasing. Places where these conversations should be had include work, home, and at school. No one place should be designated as a source for all the information we learn about these diseases. We need to build a community of acceptance and comfort in order to have these raw conversations. Depression, anxiety, bipolar disorder, and many other mental illnesses all need to be understood, whether or not you have them. By having a greater knowledge base, you can help someone else by knowing the signs. Depression is listed on Healthline as consisting of symptoms such as feelings of loneliness. How can you really know if you're depressed and not just having a bad day? Many people confuse sadness with depression. Depression is when that feeling of sadness extends over days and sometimes weeks. Anxiety has some similar symptoms, such as helplessness. In certain situations, we humans feel some form of anxiety for coming events, such as an important test or an interview for a competitive job. But when these feelings of nervousness begin to encroach and affect you daily, it can become an issue. Knowing when to talk to someone is especially important. Growing up, I was always taught to be strong and put on a brave face in any and all situations. But we must redefine strength as being brave enough and strong enough to seek help for any overwhelming emotions we might be experiencing. Bipolar disorder, or a manic episode, can trigger a break from reality, also known as psychosis. This break from reality is what occurred when my uncle went into his manic episode. It is important to note the symptoms of each type of episode, as noticing the signs can be extremely helpful in preventing them. Symptoms such as an abnormal personality, a decreased need for sleep, and distractibility pertain to the manic episode. Symptoms of a depressive episode are likewise to the symptoms of depression. With the right treatment and proper care, many people with mental illnesses can lead normal and happy lives. But we must end the stigmas of them being aggressive and it being their fault that they have these illnesses. The bottom line is this: when we understand our own emotions and why others act in certain ways, we grow in compassion. Lead by example. Smile or any form of encouragement can make someone's day better. But when you have the ability to see if someone's suffering or to realize you are, it can be extremely helpful. You will know when to reach out for help in order to make your life more joyful. Mental illness affects the world, but because so many people are uninformed, they're left to suffer in an undiagnosed state and without the facilities to combat their illness. Don't wait to contact someone who you think may be suffering from a mental illness. Can we change everything in the blink of an eye? No. But if we work together, which sounds cliche, but is true, we can effectively change the way we think about these types of illnesses. Change your mindset. Change the world. Thank you.